This is a topic that's very dear to my heart because I actually do look after two nursing homes, and I'm leader of two medical teams in these nursing homes. I have special interests in internal medicine as well as geriatric care and dermatology. Um, the the talk today is about getting up and about and active aging and how we and how I like to understand and understand the topic, understand aging as a whole, right? And I think one of the movies that really moved me several years ago when I was a bit younger was this movie called Up, right? It's a Disney movie about a elderly gentleman who goes on a huge adventure, and it's really exciting and how he gets up and about. And I thought to myself, well, guy is going to go far, right? This is the kind of guy that we all want to emulate in our elder years. Um, I think to begin with, oh, sorry, just let me, Kimmy, next slide, please. So I mean, I always like talks to be relevant. And one of the questions that I always ask the elderly when they enter my clinic, and I think probably is a question relevant to everybody here, is what do you worry about, right? When you come to a clinic, what do you worry about? And the first few big things that always pop up, I'm worried about not having enough money. Doc, I'm worried about being unhealthy. Doc, I feel very sad. I'm alone all the time, right? And these are big issues that come with all sorts of things as people age, right? You retire, you stop working. With the retirement comes the loss of income and the insecurity that comes with that. And then sometimes there's loss of independence, poor health, and with the poor health comes isolation and loneliness, right? And fears of falling and fears of losing touch with your family and getting helpers to come in and care for them and all that. So these are recurring themes that occur in with elderly patients as we age. And the biggest thing that always comes up is always money, right? It's always money, right? In Singapore, we talk about increasing healthcare costs and how that's really expensive. In fact, it's going up by about 10% every year. Just last year, they reported in the insurance that healthcare had gone up by about another 10%, 9 to 10%. If you look at this table, which is the next table, you see that the cost of healthcare, this is not a one-year thing, right? The cost of healthcare has gone up about 10% every year from 1990 to 2022, right? These are frightening healthcare costs, right? And contrary to popular belief, Lo Kun is not just out there to earn everybody's money, right? We actually want people to not pay so much for their healthcare. At least those of us who care for our patients do. And the big question has always been, well, how do we prevent healthcare from getting so expensive? I can't, how do we get healthcare from getting so expensive? A politician said, in a rally a few years ago, in Singapore, you can die, but you cannot get sick. 在新加坡可以老不可以可以死不可以病. So it's so frightening getting ill and having poor health in Singapore. And why must it be so expensive, right? A lot of patients will then talk to me, hey, Lo Kun, don't joke lah, you are the cause of the problem, right? And well, I don't deny, obviously, doctor's salary is part of it, but frankly, if you look at the breakdown, actually, huge amounts of it go into other things. It goes into the inflation of rental, right? 22% goes to drugs, which is higher than the 18% the doctor gets. Right, in America, it's the cost of having a lawyer is gone up to 7% of the healthcare, which is almost a third of, which is more than a third of what the doctor gets out of every healthcare dollar bill. In Singapore, it's fortunately not so bad yet, but it's getting there. So that's in terms of if you split the pie as to who gets the money. If you split the pie as to where the money is spent, well, you see 30%. You see this dark blue spot, that's 31.6%, increasing every 10 years. It's increased to 31.7%. Hospital care is a huge amount of it. It's about 30% of the healthcare, right? So you can see that ending up in hospital is a bad thing, right? Ending up in hospital is expensive, right? And everybody knows you go into hospital feeling well, you come out of hospital not feeling great. So it's not like this 30% of money that's spent in healthcare really keeps you in good health. It's actually just stops you from dying, right? Let's have the next slide, Kimmy. So how much, and so you exit hospital, and we all know that once you exit hospital, you're going to go back into hospital again, right? In fact, if you look at the proportion of healthcare spending, right, 5% of Americans, right, make up 50% of healthcare spending. In Singapore, it's pretty much the same. It's about 5 to 10% of Singaporeans make up 50% of the healthcare spending, right? And who are these people? Are these people who anyhow use healthcare as some of the insurance like to imply? No, right? We know that, right? This is an article. Aside from the fact that such a tiny fraction of our country was responsible for so much of our expenses, right? We found that these were high spenders that were repeated year from year, and they were chronically ill and they were old, right? So these are not people who are spending money for fun. These are people who are spending money because they have no choice, right? Because they have already gotten ill, right? And going to hospital doesn't really make them better, and they're spending huge amounts of money in hospital. They're spending huge amounts of money because they're chronically ill. So what is the solution, right? The solution is preventive medicine. The solution is don't let people get sick in the first place, right? What is preventive medicine? Preventive medicine is the practice of promoting preventive healthcare to improve patient well-being, right? The goal is to prevent disease, disability, and death. And in very simple language, the goal is to prevent us from having to spend money on healthcare, right? How do we do that, right? Well, if you want to prevent disease and death, you've got to catch people before they get disease and death. You've got to catch them as they start to lose function, right? But it does not yet result in disease and death. Okay, next, right? So preventive medicine. So what do I mean by that? Well, a lot of patients say, oh, doc, I know preventive medicine. I've heard of it, right? We talk about diet and exercise, right? Oh, well, diet's important, right? This is Singapore Heart Foundation, right? Obviously, I'm sure they've had talks about diet, right? So you guys may have heard of DASH diet, right? Which is a diet that's very high in fruits and vegetables, right? Some of you have heard of healthy plates, right? Where they say, well, you should be taking half vegetables, quarter rice, quarter meat. In fact, I tell my patients who are a little bit on the obese side, it should be 3/4 veg, 1/4 meat, right? And you only eat when you're hungry and you try and eat in the daylight hours. And we talk about intermittent fasting and all that. That's not really what I'm here to talk about. We talk about exercise too. Next slide. And exercise is important. In a nutshell, basically 150 minutes of moderate intensity exercise per week. What I wonder though is how many of us has actually sat down and asked ourselves and actually looked at the numbers and say, well, diet and exercise is important, certainly, I admit it, but does this actually result in longevity? Now, this next slide is very interesting and very important to the talk, right? And this was a slide that's based on research done by Holt and Linstead in 2010. And if you go on TED Talks, if you Google Susan Pinker, right, she gives an excellent TED Talk on longevity. But the key to it is this slide. The researchers went out to what we call blue zones. They went out to the 10 zones where they found that people lived the longest, were the healthiest, remained the most active, all the way up to the centenarian years, right? And they ranked the things that kept these people healthy in order from 1 to 10, right? And well, let's look at exercise. Where's exercise? Exercise is number 6. Where's weight and diet? Oh, that's number 7. Hey, what happened? What's 1, 2, 3, 4, 5? Well, we've got flu vaccination at 5, right? And I strongly encourage flu vaccination. But what's 1? Social integration. Social integration is work. Social integration is getting out of your house, going for a walk in the morning, saying hi to the guy who walks his dog next door, right? Getting out to work and to talk to people. That's social integration. Rank number 2, very closely behind it, is close relationships. So keeping in contact with family, right? Keeping in contact with friends, your best friend, going out to have kopi and playing mahjong, and getting to know them, keeping in touch with your friends. Now, this is very important. It's very it's very significant. It tells us that yes, diet and exercise are important, quitting smoking is important, getting your flu vaccines is important, but a huge amount of what will keep you well is actually done by the patient themselves. It is maintaining social integration and maintaining close relationships, getting out there and staying active. Next. And so if activity leads to longevity, then inactivity leads to death and disability, right? And well, what causes inactivity? That's a no-brainer, right? Physical frailty leads to inactivity, right? Physical frailty as defined by pain, weakness, disability. Mental frailty as defined by depression, social isolation, dementia, job loss, relationship loss, right? And at this point, a lot of people again tell me, wait, hang on, Alex, you know, this. You seem to be talking in circles, right? If physical frailty causes physical and mental frailty cause death and disability, but death and disability are caused by physical frailty and mental frailty. And yes, that's right. It's a death spiral, right? It's a chicken and egg, right? Physical frailty and mental frailty cause disability, and immobility and inactivity. And inactivity again feeds back into physical frailty and mental frailty. So we've got to be able to break this cycle. Next. Right? And what is breaking this cycle? Now, at this point, I need to address a concept, right, that is very dear to my heart and has been very dear to the heart of a lot of geriatricians, right? Which is that whenever an elderly patient comes to me, and whether it's in the nursing home or whether it's in the clinic, people then say, oh, you know, I look at this elderly patient that can't walk anymore. And I ask the family, hey, what happened? Right? Why is she not walking? How come she can't walk? And the most frequent answer I get is, oh, 老了. Okay, and 老了 is a terrible concept, right? Because what's 老了? 老了is okay, you become disabled because you're old, right? Which is something that people seem to accept. But to us doctors, that's horrifying, right? You do not become disabled because you get old, right? You get disabled because there are specific things that go wrong with you, right? Maybe you're depressed, maybe you have anxieties or fears that are unaddressed. Maybe you have problems with balance and strength because you've had small strokes, because you have vascular disease in your brain that's not treated. Maybe you can't walk because you can't see so well anymore. You can't see close, you can't see far, you need new specs. You've got cataracts, right? Maybe you can't walk, can't get out so far because you've got chest pain and breathlessness, and that's not addressed, right? Or you've got bladder issues, right? So you're afraid to go out because you can't control the bladder anymore. It's embarrassing to wet the pants. Or maybe because the bone and muscle strength is not what it used to be. Maybe because it's pain, and at Singapore Paincare Holdings, we address a lot of that, right? Pain, knee pain, shoulder pain, foot pain. And people with pain, the thing is, they don't tell you I'm in pain. They minimize, right? That's a classical thing about the elderly. You know, oh, you're in pain. Auntie, are you in pain? No, I'm not in pain. But she's chugging like Panadol, like, you know, it's M&Ms, right? So clearly the patient is in pain. It's not being addressed, right? And so it's very important for us to recognize this concept that that 老了 is not a reason for people to not walk anymore. It's not a reason for people to not have activity anymore, right? 老了 is really just a huge umbrella that covers all these things that tend to come with old age. But if you catch them early and you intervene, it is eminently treatable. I'll give you a quick example. Okay, an elderly patient that falls, and we all know falls are a big problem in the elderly, right? What do you mean? They're what we call in the geriatric giants, right? If you fall, right, the chances of you hurting yourself are high. It's a multi-billion-dollar problem worldwide, right? And if you fall and if you break a hip, your chance of dying, and we'll see this slide later on, your chance of dying is as high as 50 to 80% if you're elderly within a year, right? It is a problem, it's a huge problem, right? But why do people get to falling? And there are many reasons, right? If you just look at this, you fall maybe because you can't see, right? And why can you not see? Well, it starts with small problems like don't have the right specs, got a bit of cataracts, can't see so clearly, fell down, right? Or I've got a bit of knee pain, right? Couldn't take the proper step. You know, normally if you slip, you take a step forward to try to stop yourself from falling. But if you've got pain, you don't treat it, right? The step that's supposed to save you becomes the step that trips you up and makes the fall worse, right? Hearing, right? Well, you walk and somebody goes, hey, floor wet, huh? Careful, huh? And you don't hear, and you slip and you fall. So these are examples of how small problems pre-disease, right? I've got a bit of, I got a bit of vision, it's not so good. I can't be bothered to treat it, or I don't want to trouble my children about it. I'm just going to let it be, right? Leads to a fall, which is your disease, right? And if you fall and you break something, and if you're in your elderly years, then your chance of dying becomes very high, and that's death and disability right there looking at you, right? So it's very important. This is a very important concept. It's very dear to my heart. It's one of the core concepts of the speech of the talk today, which is that lao liao is not an excuse for not treating things in our elderly and not helping them get back out there and getting them back on their feet. Okay, so then patients tell me, hey, doc, I don't want to come to you all the time, right? I want to come to you only when I have a real problem, right? Am I supposed to bring my elderly parent in every year, for health screening? Yes. Actually, if you look at what the government HPB's recommendation, Screen for Life, they tell you elderly should screen their health every 2 to 3 years, right? And do a stool or cord blood testing every year. Yes. But what about in between, right? When do you go and see the doctor? Well, there are several good measures of this. And the simplest and easiest to understand from a layperson point of view is what we call the up and go test. And this can be done by anybody in any setting. It's super easy to do, right? What you do is that I just want to see whether you can get out of a chair, stand up, use whatever mobility aid you need. So if you're in a frame, you're in a frame. If you're in a walking stick, you've got a walking stick, right? If you don't need anything, you don't use anything. You stand up and you walk 3 meters. You walk 3 meters, you make a 180-degree turn, you walk back another 3 meters, and you sit down again. And this whole process, if you are fit, then it should not take more than 20 seconds, 10 to 20 seconds. That's the range for frail elderly. Okay? And if you take more than 20 seconds, then you probably need to look at why. And if you're taking longer than 30 seconds, then you're very, very high risk that you're going to fall and hurt yourself, right? And this is what I call the up and go test, and what I strongly encourage a lot of the elderly to do. Do your up and go test, right? Sit at home, right? Stand up, walk 3 meters, walk back again, sit down. If you can't do this in 20 seconds, then something is wrong, right? And you need to sit down and ask yourself, or your parents can't do this. You need to sit down and ask yourself, hey, why can't they do this? Is it an eye problem? Is it a feet numbness problem? Is it a muscle strength problem? Does this patient need to go for physiotherapy? Is it a knee pain problem? Do they need to manage the pain, right? Do they need knee injections? Do they need knee operations? This is a good indicator that the patient may well fall and hurt themselves, right? Next, right? How relevant is this? Well, it's very relevant because slow walkers, right, as you can see from this slide, right, have a life expectancy that's a good 20 years less than the fast walkers, 10 to 20 years less than the fast walkers. And next, and this is the slide that we talked about. If you fall, you break something, you die, right? If you're in your 80s, right, and you fall, your 1-year mortality can be as high as 50 to 80%, higher in the men than in the women. Okay, next. And even if you don't fall, even if you fall and you don't break anything, and then you just get scared, you get depressed, you get anxious, you get stuck in a chair, or you fall and you can't get out of bed, and well, we'll bring you to the surgeon will put in some metal, will fix you up. But in the meantime, you get stuck in a chair for 10 days, 20 days, 30 days. What happens? Well, if you don't use it, you lose it, right? If you get stuck in bed, for each day that you get stuck in bed, you lose between 1 to 5% of your lean muscle mass. right? And we recognize that acute sarcopenia, acute loss of muscle mass due to hospitalization, due to immobility, is a huge issue. It's a huge issue, and it needs actual rehab. You have to put in a lot of effort to get this person back on their feet, even if there is nothing physically wrong with them, even if the bony structures have been fixed, right? Next, right? And so it's important to avoid prolonged bed rest. So coming to the end of the talk, right? I think there are a few core concepts that I want to bring across today. Okay, number one is that aging is not a process, a vague process by which people get old and then, oh, they can't walk anymore, right? This process that we call old can be tied down to specific things that have gone wrong to the body, some of which are irreversible, true, but some of which are very, very reversible. And if you address it before it becomes as pre-disease, you can then prevent disease, you can prevent death, you can prevent very, very costly things from happening, right? Secondly, once you are stuck in disease, right, and disability, it's going to be very expensive. So you don't want to get caught there. You don't want to get stuck there. Number three is that actually, although it sounds very complicated, there are a lot of components of what causes aging and disability. It's very easy to assess socially, right? If you have someone who can get out of their chair, they can walk 3 meters, they can come back, they can sit down and do this in a reasonable amount of time, then this patient is a healthy patient. If you can't do it in 30 seconds, right, then this patient is very high risk to fall down and hurt themselves. And once they do so, we talk about immobility, we talk about mortality, we talk about death, we talk about all the terrible emotional cost as well as the financial cost that comes with it. And so going back to the very beginning, when we talked about, this elderly man got out on an adventure and got out there and ran around with his house, and went to explore the world. I would say to each and every one of us who are present today, guys, do that. Okay, even if you can't do that, get out there and walk, get out there and stay active. It seems like a no-brainer. It seems like, silly advice, but you have seen from the slides that this is the primary thing. Staying active in the community, keeping a job, meeting family and friends is what is going to keep you in good health and going to keep you up and about and keep away those expensive dollar bills and these expensive doctor bills for as long as possible. And so on that note, I'd like to wish everybody good health. I'd like to wish everybody, that you maintain your activity and stay healthy and active and involved in your community. And if anybody has questions, I'd be happy to answer them. We've got some questions that were submitted before the talk, so I think I'll just briefly talk through them. The first question was, what are common pains that seniors usually have, and how do we prevent them? Okay, it's a bit difficult to answer this question because there are many kinds of pains. I think as a general rule, good levels of physical activity and general health are important, right? A great deal, we see a lot of back pain, we see a lot of lower back pain and shoulder pain, and a good amount of this is linked to insomnia, lack of sleep. About 70% of back pain is linked to insomnia, right? And the treatment for that, other than massages and physical therapy and trainer and all that, actually is to maintain is to get enough sleep. Knee pain is another very common complaint, right? People say, oh, I can't walk because I got knee pain. Interesting research actually shows that if you walk, you actually get less osteoarthritis, you get less aging of the knees, right? Mild activity is associated with less aging of the knees, right? And if you're getting a lot of knee pain, that what you actually need to do is you need to do more knee exercise, not less knee exercise, but you might have to know what is the appropriate kind of knee exercise to do. And there's plenty of this advice online, and if you read it and you're not confident of carrying it out yourself, you can see a physiotherapist. Is there another question? Kimi? Right. No, forward. Okay, stress. Okay, this other person was very concerned about stress. They said, I've got stress at home and at work. Should I manage it? Well, this is an interesting question. I think we talked a little bit about how staying engaged in the community is good for people, but of course, too much of something can also be bad, right? And so, stress comes in many forms, and it's important to address it and manage it, right? Uh, so so I would say, well, once you get to your 50s and 60s and 70s, or even in your younger years, it's important sometimes to recognize that that the stress needs to be directly managed, right? I have young people coming to me complaining of insomnia, and they don't want to open up until I find out that they're working 3 jobs at the same time, right? And that leads to insomnia, and they can't sleep, and then they start complaining of all sorts of gastric pain and breathlessness and anxiety symptoms and tremors. So sometimes we just have to take a step back and manage the stress itself. Um, the other thing, of course, is, sorry, can you go back there? The other thing, of course, is that I think we talked about how sleep is important, and less than 7 to 8 hours of sleep is strongly associated with depression and anxiety, and even later on dementia and delirium. And so it's important to get enough sleep. It is often a good start point for people to get control of their lives, because even if you can't control everything else, you can to some extent control the time at which you decide, okay, I'm going to stop doing what I'm going to do and I'm going to sleep. Sleep hygiene is a whole different topic, which I won't address here, right? Insomnia is a whole different topic, which I won't address here, but it's a huge topic, and we can have an entire talk on just that. Exercise is important. Exercise is not just important because of the muscle strength it gets you and because of the cardiac fitness it gets you, but because noradrenaline, because of the hormones it produces, the noradrenaline and adrenaline actually do get people up, right, and about, and it wakes the brain up. And adrenaline helps to, and the adrenaline helps to manage a lot of the stress, right? So, and then of course the last thing is that if you're very stressed, the question is, are you depressed or are you anxious? Does that need to be managed? And if it does, then please do get help. As a patient ages, does he need more sleep? No, not really. The typical adult needs about 7 to 8 hours a day. You need more if you're a young kid. What foods best mitigate stiff joints? Okay, now this is a difficult question. Stiff joints can happen for many reasons. If you are young and you get early morning stiff joints, then something is very wrong with you. You need to go and see a doctor. If you're a little bit older and you're talking about, what we call 风湿, right? Then 风湿, right? Then sometimes it's getting out and getting exercise in. There is no food per se, unfortunately, that helps with this. But general weight management and eating healthy does help. How to prevent dementia? Oh, that's a big topic, and it's a topic all of its own. There are all sorts of risk factors for dementia: age, family history, mental disease, diet and exercise, alcohol, depression, smoking. Head trauma is interesting. A lot of people who engage in very physical, active contact sports tend to get early dementia. We believe that this is microinjury of the brain. Insomnia is very important. People who chronically get less than 7 to 8 hours of sleep a day in their younger years tend to develop early dementia. Hearing is another thing. A lot of people, as they get older, they have hearing problems, and they are like, it's okay if I don't hear so much, and they don't get the hearing aids. And actually, a loss of hearing has been strongly associated with early onset dementia as well. Are there any foods? No, there's not. Well, there's some studies that say ginkgo nuts, or that does help a little bit. There's one study that says coconut oil. The evidence is not very strong. Main thing is eat clean and exercise. Commonest aging myth. I think I covered this during the talk. Basically, the biggest aging myth I've heard is that functional deterioration is due to aging, right? And that a lot of the dysfunction that comes with aging actually comes down to a diagnosis that's manageable and treatable. Next, heart palpitations. I'm not sure who asked this question, but if you have heart palpitations, please do see a doctor. There are many reasons why people have heart palpitations. and many different causes, and it's probably best to see your GP for a proper diagnosis and a proper workup. I don't think this is really a question we should be addressing over a talk. Okay, so this last slide is important. Basically, this is I'm flashing this on behalf of my colleagues from AIC to let you guys know that there's a lot of assistance out there, and there's financial aid out there. There's all sorts of home caregiving grants and caregiving grants, Elder Shield, Elder Fund, enhancement for activity in seniors and all that. And if you think that you have disability and that you deserve some sort of grant, please do email AIC and say, you know, I think I need some help. Is there any help you can offer me, right? I know that sometimes people are afraid to ask for help. Please don't be. There's an entire agency that's set out there to try and keep people hale and hearty and in their own home, and to offer you guys help. Okay, I think maybe we can open the questions to the floor.
Okay, thank you, Dr. Wong, for the very good sharing. We'll now proceed with the live Q&A. So if anyone of you have questions for Dr. Wong, please leave them in the Zoom chat. And please limit yourself to one question so that everyone can have a chance to ask our speakers. Okay, is any more questions? Is questions coming in? Anyone have questions?
If you can't type, I'm okay with you to just ask it. Or yeah, I also can 讲华语 no 问题，没有问题。好功夫啊。
Anyone have questions?
I understand a little bit of Malay, but not too much.
Is there any questions for Dr. Wong?
Well, by doing some stretching and all that, no, the Chinese, they call it the tun, shuai shou, does that help?
Okay, there's
this.
You're talking about help with what?
Shuai shou.
With help with what? Help with leg weakness, help with back pain?
Nerves overall and everything.
Okay. I think walking is actually very useful, right? Walking, and for those who can't walk, aqua walking, right? Basically, you go into a pool and submerge half your body and allow the pool to support your body weight. If you're talking about these traditional exercises, one exercise that I really like a lot is actually Tai Chi, because Tai Chi, actually, you know, the Dharma, right? And the Tai Chi, the stances actually generate a lot of core body strength, which if you look at our population, a lot of people don't have a lot of core strength, and the loss of core strength causes a lot of back pain when they try and carry heavy things, and that is one of the common problems why people end up with a lot of chronic pain, chronic back pain. So I don't know about the shaking of hands, and I don't think there's any evidence around that. Whether shaking hands and shaking knees and legs and all that helps, but I think definitely some of these exercises that people like to do with the community, this Tai Chi Chuan and all that, it does help quite a bit. Does that answer your question?
Yes, thank you.
Okay.
Because sometimes I don't go out to walk, I just do that at home. I thought that is enough for about 30 minutes. I thought that is sufficient.
If you get stuck at home and you can't do anything else, then you can just turn on a YouTube video and do some Zumba, right? Follow the YouTube video, do some Zumba. Follow the YouTube video, do some Tai Chi Chuan. Nowadays, you know, there's internet, so that's quite useful. But if you are very afraid of the internet, then you just do walking at home. That's better than nothing at all.
Okay, there's one question from Mr. David So. So, hi, Dr. Wang, are Singapore elders aging gracefully, and how is aging here different from aging in other countries?
Thanks, David, for the question. Well, I would say that I'm not aware of the specific numbers behind whether Singaporean elderly are doing better than the elderly overseas. I think obviously if you compare us to places like Okinawa and places like, in Italy, all the blue zones, clearly we are not doing as well. Partially it's a function of small nuclear families, right? So the nuclear family, unfortunately, is a fairly new concept that has resulted in a lot of these old family structures breaking up. So young children are no longer looked after. So young parents are very stressed looking after their children because they don't have the help of the elderly anymore, and the elderly get a bit disconnected from the young. So I think even the government has realized this, which is why there's this move towards intergenerational flats and all that. So the urban environment, I think, is probably not great for our elderly. And for a long time, we didn't really have a lot of parks and all that for the elderly to exercise in, as well as some of these rehab projects. But I think we've caught up a lot in the recent years, and even now there are parks everywhere, and there's all sorts of engagement from Heart Foundation and AIC and a lot of people who like to, a lot of these organizations that are trying to engage the elderly to exercise and to move around. I would say we're not doing too badly. I think we could do better in terms of screening for depression. We could do better in terms of screening for anxiety. These are reasons why people get very isolated. We could definitely do better in terms of encouraging a stronger family structure to get people to talk to each other and to interact with each other. I think, unfortunately, some degree of it is going to be difficult to do because of the urban environment and the urban lifestyle that we have with, both parents doing, working at the same time, dual income families and all that. So there is some limitations to our social setup that I think, unfortunately, we just will not be able to change. Do we age more quickly in body and mind? I think that actually, if you look at our age, life expectancy, actually we do reasonably well as compared to the OECD. I think our life expectancy is actually quite good, and life expectancy is usually a good surrogate for other things like basically general health and mental health. So I don't think we're doing too badly. Could we do better? Yes.
Okay, thank you. There's a second question from Christina. So for seniors who are taking multiple medications with multiple illnesses, do they age more quickly in terms of their bodies and mind?
Sorry, no, that was the previous question, right?
Oh no, the previous question was aging gracefully.
Oh, it's for seniors taking multiple medications. Well, yes, because having multiple illness by itself is a risk for basically getting more sick, right? So I mean, the point is not the medications, right? The point is there a way to prevent people from getting to the point where they need multiple medications, right? I always see medication as a thing where you take it because you already have no choice, right? Your doctor, it doesn't harm you per se, but you have to take it because you have reached a point where your body has broken down to where your doctor is forced to give you medication, right? So I think the focus here is not on the taking of the multiple medications, but the multiple illnesses that we want to prevent. There is some issue with polypharmacy. Obviously, we do want to reduce the amount of medication where people are taking as much as possible. But it's important to note that that people shouldn't be cutting their medication on their own, because in general, if people ask you to take medication, there's a good reason for it. So there needs to be a balance lah. Long and short of it is you take what you have to, and things that you don't need, well, you should try and cut out, right? And actually, one of the things that most commonly I find that people are on that's unnecessary is supplements. Things like B12, vitamin C, omega-3 fish oils. Actually, there's a lot of polypharmacy from that that's actually unnecessary, folic acid and all that. Right. So to answer that question, yeah, I think you can de-prescribe, you should, but please don't do it on your own. How are nursing homes? Can I just I just read it myself? How are nursing homes here in Singapore? What can be done to improve the nursing care in Singapore? These are two very different questions. How are the nursing homes in Singapore? Wow, it's a huge range. I've seen very, very terrible. I mean, I've seen very, very good, very organized, very clean and efficient nursing homes with good nursing leadership. It's a huge range. I would suggest that before you go to the nursing home, you go and you go around and have a look at it yourself. It's not the best. It's not, it's not going to be a wonderful place. But some of these places are actually quite decent and quite clean. Then there are the ones that are really, really terrible, and I won't mention names. I think the two that I work at, I'm quite picky at the nursing homes that I work at. A number of them asked me to work there. I turned down quite a number. So I'm quite happy in All Saints Home. I feel that at least the branch that I work in Yishun is quite well cared for. And then Ling Kwang Home is decent, not too bad. I think the building is getting a bit aged, but in general, nursing care is quite solid. What can be done to improve the nursing care in Singapore? Wow. I presume you're talking about nursing home nursing care. The problem with nursing home nursing care is a very complex one. It's primarily, I would say, grounded in funding issues as well as promotion issues. If you work in a nursing home, if you're a nurse working in a nursing home, there's not much career progression for you. So that's one big problem. And the second thing, of course, is that because the pay is not great, very few Singaporean nurses willing to work there. And so you end up having to get a lot of foreigners in. Foreigners, they're good people, but they have morale issues because the pay is low and they're far away from home and they don't speak the language. So it's very difficult for them to establish a relationship with the residents. The residents can be living there for 5-10 years and not even know the names of the nurses looking after them. And I don't think that's good for either the elderly or for the nursing home staff. So I would say I would start with looking at pay of the nurses and career progression and work from there. Robert, what should we do if we have very dry skin? Using moisturizers does not seem to help as skin is still itchy. Well, skin can be dry and itchy for many reasons. You probably should see your doctor and see why. If your skin is very persistently itchy, it can be a liver problem, a kidney problem. It can be a vein problem. Most commonly, it's just poor circulation, usually in the lower legs. And the treatment, yes, is moisturizers. If it's getting very bad, you may benefit from a course of steroids. I would advise, if you would just ask me 3 things that will make a difference, I would say moisturizers. I would say stop using soap because soap is quite damaging to the skin. And I would say don't scratch, right? If you're itchy, just grab an ice pack and ice it because scratching it definitely makes it worse. Also, COVID advice to, I can't constantly wash hands. Yes. Also, COVID advice to constantly wash hands causes dryness. Yes, it does. The only thing I can say is after you wash your hands, quickly moisturize again. I'm very liberal with moisturizer. My kids apply moisturizer 3, 4, 5 times a day even. So I don't think there's anything wrong with frequent moisturizing. What do I think of the keto diet? I think it's a bad idea. I think it's a terrible idea. The thing about keto diets is that they try to make people lose weight by filling them up with fat. It can cause your cholesterol to go very, very high. I think if you're interested in diet, I think you should look at the DASH diet. Intermittent fasting works. It works very, very well. And the best way to intermittent diet, I find, is to just make sure that you eat during the daylight hours, because the night hours are something like a good 12 to 16 hours. So you only eat in the daytime, you are effectively intermittent fasting. The other thing, of course, is a lot of people are usually used to eating 3 meals, and I would say don't do that. If you have weight issues, don't eat 3 meals. Eat when you are hungry, and when you are hungry, eat vegetables. Yeah, so in short, DASH diet, you want to look at that up on the internet, DASH, not keto diets, please. Yeah, okay, that's it. Any other questions? I'm still happy to take more questions if you. I think we have a good 10 minutes more. Any of the people who ask questions want to clarify anything that I said?
Any more questions before we end these sessions? No, yeah. It seems that there is no more question. Oh,
wait, there's a message there. There's a message there.
Yeah, there's no message.
Okay, is Panadol a good pain management drug? I would say no drugs are good pain management drugs. Preferably, I would rather you guys don't take drugs at all if you can help it. Pain management always begins with assessment, a proper physical assessment of the patient, with regards to, well, let's start with non-pharmacological things like sleep and whether or not there's an underlying anxiety and depression. And then, of course, you want to look at exercise and physiotherapy. And then if you really have to, you have interventions, injections, operations if you need them. And then only then, if we really need to, then we put you on chronic medication. Now, if you have to look at medication, I would say that Panadol is probably the best of them, right? Because Panadol is fairly safe if you use it in a responsible way. If you take 2 tablets 4 times a day and you don't exceed that, you're probably going to be okay. Panadol is very, very underestimated. If you look at the effect of 1 gram of Panadol taken constantly 4 times a day, it is actually almost as effective as a lot of these other drugs that people talk about. These so-called stronger drugs that people talk about, things like tramadol and morphine. And if you combine Panadol with other modalities, it does tremendously well. So Panadol as a combination with other things does very, very well. So I would say don't take drugs unless you have to. Stress on lifestyle and exercise and physiotherapy. If you have to go for a procedure, please go for it. As far as Panadol is concerned, yes, it's a very underestimated drug, and if you have to go on drugs, Panadol rather than NSAIDs rather than opiates, because the NSAID group, which is all your diclofenac and all that, can harm the kidneys and the stomach, and the tramadol group tends to make elderly people a bit drowsy and can make them a bit confused and predisposed to falls and stuff like that. So if you have no choice, Panadol is probably your best shot. And if you are going to take Panadol for pain, it is better to take it before you are in pain. That is to say, pain is much more difficult to control once you start feeling it. So round the clock Panadol if you really have to, if you know you're going to be in chronic pain. But if you are taking round the clock Panadol for weeks and months on end, then something is not quite right, and we probably need to address it. What is my take on complementary medicine? The correct answer from a modern physician's point of view is I don't know. I don't know because there is not that much good research done into complementary medicine that has stood up to peer review studies. What we do know works. Acupuncture definitely works. That has been studied, and it works and it's good for pain control. A lot of the other stuff, unfortunately, the research papers that are coming out from China and even Taiwan, unfortunately, are not very good quality. And in fact, China is well known for, unfortunately, being one of the biggest. I think China in 2013 was responsible for more recalled research papers than the whole world put together. So while as Chinese, I would be proud to say, you know, my traditional Chinese medicine can contribute a lot to the world. Unfortunately, China in its current state is not producing very good research. So it's very difficult to say what works and what doesn't work. If you want to find something that works, I would say that acupuncture works, yes.
Is there any more questions? If not, we will end these sessions now. So once again, thank you very much, Dr. Wong, for the very informative session.